Thank you, Representative Bynum. Good morning, everyone. I'm Congresswoman Kelly Morrison. I represent Minnesota's 3rd District, and for more than 20 years, I've had the honor and privilege of caring for patients as an OBGYN. And now I'm very proud and humbled to be the first and only pro-choice OBGYN in Congress. 2.5 years ago, the Supreme Court overturned 50 years of precedent and issued the Dobbs decision, overturning Roe v. Wade, and for the first time in our country's history, taking away a right. Today, as we recognize what would have been the 52nd anniversary of Roe v. Wade, we acknowledge the harsh reality that our country is facing. A maternal health crisis was unfolding across the United States before Roe was overturned, but that decision has only served to accelerate that crisis. Today, women have less rights to health care than their mothers and grandmothers did. 44% of women and more than half of Black women of reproductive age live under abortion bans. Over a third of counties in the United States are maternity care deserts. And we're facing a shortage of OBGYNs that is only expected to get worse. These are serious and dangerous threats to women, children, and families. Voters across the country have shown that they want to preserve a woman's right to access the health care that she needs. Voters in red, purple, and blue states from Missouri and Montana to Arizona and Colorado to New York and Maryland voted for reproductive freedom in this past election on state ballot initiatives and constitutional amendments. And I want every woman to know we see you, we hear you. House Democrats will do everything we can to prevent this Republican Congress and this administration from going against the will of the people and further eroding your rights. Unfortunately, later this week, Republicans will resume their efforts to restrict access to maternal health care, pushing through a bill designed to confuse, frighten, and misinform people and criminalize medical providers. A cruel bill that singles out patients who are facing one of the worst days of their lives. In this moment, we should be doing everything we can to support women and their doctors, not attack them. So on this anniversary of Roe v. Wade, we mourn what has been lost and we redouble our efforts to restore your rights. We will never back down. We will always fight for your right to reproductive freedom. Thank you, and I will turn it back to the chairman.